This tutorial will review the patient assessment directory of the Living Younger Lifestyle Medicine System. The patient assessment section includes all the tools necessary to test, measure, examine, and evaluate patients. It should be noted that all the patient assessment tools can be accessed directly from a patient's chart without having to open the Living Younger home directory. Some of the sections in the patient assessment directory will be covered in greater depth in subsequent tutorials. Note that in the bottom right corner, the Clinical Assessment Manual will provide a number of tools and guidance and references for evaluating patients. Living Younger system includes 7 different medical history questionnaires. The comprehensive and the HRT medical history questionnaires have male and female specific questionnaires. All of the medical questionnaires contain the core elements of a good medical history, such as the patient's problems, allergies, medications, surgeries and hospitalizations, family history, and a comprehensive review of systems. Where they differ is what is added on top of that. For example, in the weight management, nutrition, and comprehensive medical history questionnaires, additional questions are added regarding the patient's nutritional lifestyle. The fitness and the comprehensive medical history questionnaires include additional questions regarding the patient's physical activity, sports, exercises, etc. The HRT and comprehensive medical history questionnaires include a number of questions that are specific to symptoms that the patients might exhibit regarding high or low levels of hormones. The comprehensive medical history questionnaire includes numerous evaluation questions regarding the patient's lifestyle, disease risk factors, etc., not found in any of the other medical history questionnaires. The questionnaires will be examined in more depth in a subsequent tutorial. My Folders is a guide, or rather a place to aggregate documents into one location that you might send to a patient for a consultation. The My Folders contain corresponding medical history questionnaires. The comprehensive nutrition and weight management folders also include a meal journal by default. You may add additional content to the folders to prepare the patient, such as privacy practices notice, electronic communication, informed consent, consultation contract agreements, etc. This section will be reviewed in greater depth during a subsequent tutorial. The comprehensive medical history questionnaire includes all of the symptom analysis questions that you see on the symptom assessment subdirectory. The HRT medical history questionnaire includes all of the hormone-related symptom questions in the medical history questionnaire. However, you can individually evaluate patients' symptoms with these various questionnaires. For example, if you have a male patient and you wish to evaluate the patient for potential BPH symptoms, a questionnaire such as this can be sent to your patient or printed out, or the patient could just simply fill it out while they're in the office or prior to coming in to see you, such as simply checking here, and you'll see that this interpretation based upon the American Urologic Society is that the patient has severe BPH symptoms. Now, based on this, if you have a desire to send or provide the patient with some educational material, on the navigation panel, you click Patient Handout, and you can send or print this for your patient. Furthermore, if you wish to review management of BPH, clicking the Clinical Reference tab will open up our clinical reference manual on the management of BPH. It should be noted that all of the symptom questionnaires are integrated as well into the patient charts. So when you're charting, you can access these questionnaires and actually flow chart the results in the patient's chart. This will be reviewed in depth during one of the patient chart tutorials. A number of physical examination tools are available in the Physical and Fitness Examination subdirectory. A complete, comprehensive physical examination form is available. A human performance and fitness testing worksheet is available, which will be reviewed in a subsequent tutorial in great depth. Throughout the system, you will also have access to a number of web-based resources outside of the Living Younger system. And then all of our calculators can be individually accessed. These are some of the physical fitness ones, but there are others in the system, as you'll see later. Clicking on one of those opens up one of our calculators that you can just fill out very easily, such as here. And you'll notice that it will classify the patients, in this particular case, the body mass index, with the classification and the disease risk rating. All of our calculators will have a chart showing how the results compare overall. You have help buttons. You have clinical resources available at any time. These and others calculators are all integrated into the patient's chart and can be accessed at any time. And just like blood pressure or weight or lab, you can flow chart any of the measurements that are in the system here. There are a number of disease risk calculators built into the system, from cancer risk, hip fracture risk assessments, coronary heart disease, etc. We also have a tool for assessing your patient's biologic age. This particular tool will be reviewed in depth in a subsequent tutorial. All of these tools are available from within the patient's chart. A number of lab assessment forms and tools are available. This is a lab requisition form. These are also integrated into the patient's chart and will be reviewed in a little more depth during a chart tutorial as well. But I will mention that all of the panels can be edited. You can customize your lab requisition panels or select the types of individual tests that you would like displayed. You have access to ICD codes. We have like a worksheet here that maintains those that you commonly use, but you can also access and search codes as well. This will be gone over in a little more depth during a subsequent tutorial. Additional information is available on the fly, such as laboratory interpretation information, web resources, as well as optimal hormone values. Again, all accessible from the patient's chart. Nutrition assessment tools are built in, such as a nutrition questionnaire, a meal journal that you can have your patients complete, and these also include visual portion guides to help your patients determine portions that they're eating. We have calculators that allow you to determine how many calories your patients are burning from physical activity. Calculators to help you determine ideal or recommended body weight and necessary calories, which also will have access to a variety of customizable meal plans, portion trackers, etc. Let's go back to the patient assessment under nutrition. Finally, we have a number of consultation report forms that are accessible in the system as well.